Good morning, wherever you are. This is Sage Harlan from ConferenceHype. Our segment will focus on comparing major adverse limb events in claudicants with complete, partial, and non-adherence to preoperative guideline-directed care. From the 2026 JUL 22 edition of Journal of Vascular Surgery. Background: the Society for Vascular Surgery recommends surgery be reserved for claudicants with severe lifestyle-limiting symptoms, despite optimal medical therapy and supervised exercise therapy, the sum of these known as guideline-directed care. Methods: a retrospective analysis was performed on claudicants with open surgery or endovascular intervention at a tertiary care institution between 2016-2023. Results of the 258 claudicants receiving open surgery or endovascular intervention: 13.9% demonstrated non-adherence to GDC, 73.3% demonstrated partial adherence, and 12.8% demonstrated complete adherence. Discussion: complete adherence to preoperative GDC is protective against male in claudicants undergoing intervention out to 2 years post-intervention, whereas partial adherence may not offer a similar benefit. From the 2026 JUN edition of Journal of Vascular Surgery. Background: maintaining robust surveillance programs for abdominal aortic aneurysms is important, but these programs are expensive and labor-intensive, typically requiring manual data review by trained healthcare professionals. Methods: this study examined ultrasound and cross-sectional abdominal imaging reports randomly selected for human review from a prospectively maintained AAA surveillance registry within an integrated health system from 2008 to 2024. Results: there were 16,331 human expert-reviewed abdominal imaging reports for 11,799 patients included in the LLM analysis. Discussion: LLM extraction of aortic information from abdominal imaging reports is exceptionally reliable without the need for additional human-directed training. From the 2026 May edition of Journal of Vascular Surgery. Background: to evaluate the 5-year long-term outcomes of in situ laser fenestration, assisted thoracic endovascular aortic repair for acute type, a dissection involving zone 0 with all 3 supra-aortic branches reconstructed. Methods: this single-center, retrospective consecutive series included 152 zone 0 acute type, a dissection patients treated with 3-branched ISLF-assisted TEVAR. Results: ISLF-assisted TEVAR with triple branch reconstruction was performed in all 152 patients. Immediate technical success was 95.4%. Discussion: in this single-center cohort, ISLF-assisted TEVAR for zone 0 acute type, a dissection achieved high immediate technical success and acceptable complication rates with sustained branch patency over 5 years. From the 2026 JUL 24 edition of Journal of Vascular Surgery. Background: in patients with chronic limb-threatening ischemia, the best endovascular versus best surgical therapy in patients with CLTI trial demonstrated a significant benefit of infrainguinal bypass with single-segment great saphenous vein. Methods: we conducted a single-center review of unique CLTI patients who had vein mapping before an open or endovascular intervention was performed. Results: we identified 223 patients. Discussion: the majority of patients with CLTI had adequate thigh GSV, with a high percentage having adequate GSV throughout the entire leg.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 May edition of Journal of Vascular Surgery. Background: the Writing Committee from the Society for Vascular Surgery has commissioned this systematic review to support the development of clinical practice guidelines on the management of patients with blunt thoracic aortic injury. Methods: we searched MEDLINE, EMBASC, Cochrane Central Register of Controlled Trials, Cochrane Database of Systematic Reviews, and Scopus. Results: we included 21 studies across 7 key clinical questions. Discussion: this systematic review demonstrates a limited evidence base with high uncertainty for numerous patient-important outcomes. From the 2026 May edition of Journal of Vascular Surgery. Background: in recent decades, national acute aortic dissection mortality rates have decreased, whereas Medicare expenditures have risen, raising questions about the value of care. Methods: we conducted a retrospective, longitudinal ecological study using publicly available aggregate data from 1999 to 2020. Results: from 1999 to 2020, the average national age-adjusted AAD mortality rate significantly decreased from 6.2 to 4.3 deaths per 100,000 population, whereas per beneficiary hospital expenditures steadily rose. Discussion: increased Medicare spending for both hospital-level infrastructure and physician services is significantly associated with reduced age-adjusted AAD mortality at a population level. From the 2026 May edition of Journal of Vascular Surgery. Background: introduction, social and structural determinants of health significantly influence the management and outcomes of vascular surgical patients. Methods: a scoping review was conducted from VQI inception to present according to ARCSI's 5-stage framework, and the preferred reporting items for systematic reviews and meta-analyses extension for scoping reviews guidelines. Results: the search identified 968 unique citations using SVS VQI data. 67 met all inclusion-exclusion criteria. Discussion: improving our understanding of how SDOH impact presentation, management, and outcomes among vascular surgical patients is important to mitigate health disparities. From the 2026 June edition of Journal of Vascular Surgery. Background: to assess the spontaneous endoleak resolution rate and its associated factors in patients without aneurysm, sac enlargement undergoing imaging surveillance with computed tomography angiography following complex endovascular aneurysm repair procedures. Methods: a retrospective analysis of 230 consecutive patients at a single institution was undertaken. Results: pre-discharge CTAs have revealed Ls of any type in 75% of patients. Discussion: provided stable aneurysm sac dynamics, CTA surveillance might be considered for patients presenting type 3 EL or mixed type 2-3 EL at pre-discharge CTA scan.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 24 edition of Journal of Vascular Surgery. Background: introduction, our understanding of plaque morphology and its relationship with procedural complexity, and immediate technical failure in percutaneous vascular intervention is poorly understood, particularly in tibial disease due to significant limitations of CTA, DSA, and DUS imaging. Methods: patients scheduled for PVI underwent preoperative UT MRI. Results: 47 patients with 90 arterial lesions were included. Discussion: UT MRI-defined staging is strongly associated with ITF, crossing time and need for crossing device escalation, whereas TASC staging had no influence on ITF. From the 2026 Jul 22 edition of Journal of Vascular Surgery. Background: Introduction. Saccular abdominal aortic aneurysms lack a specific ICD code, and data on clinical outcomes and size criteria for repair remain sparse. Methods: we performed a large language model, assisted term search to identify all consecutive patients with saccular abdominal aortic aneurysm at a large multi-system hospital between April 1999 to August 2025. Results: the LLM accessed 1.3 billion clinical notes in 8 million patients over the study period and identified 298 patients with SAAA and 42,971 with FAAA. Discussion: rupture of AAA due to saccular morphology seems rare. From the 2026 Jul 21 edition of Journal of Vascular Surgery. Background: depression affects 20% to 37% of patients with peripheral artery disease, frequently requiring serotonergic antidepressants while receiving antiplatelet therapy concomitantly after vascular intervention. Methods: in this retrospective cohort study of prospectively enrolled patients with PAD undergoing lower extremity revascularization at a single U.S. tertiary care center, serial thrombolistography with platelet mapping data were used to construct consecutive visit pairs. Results: among 514 enrolled cases, 330 contributing 896 consecutive visit pairs were included. 307 patients contributed 838 consecutive visit pairs in the complete case adjusted analysis. Discussion: serotonergic antidepressant initiation, rather than stable ongoing therapy, was associated with increased instability in AD-mediated platelet inhibition after lower extremity revascularization. From the 2026 Jul 24 edition of Journal of Vascular Surgery. Background: the Society for Vascular Surgery Vascular Quality Initiative Endovascular Abdominal Aortic Aneurysm Repair Registry represents the largest and most comprehensive prospectively maintained non-claims-based dataset of endoluminal repairs in North America. Methods: all EVAR procedures from 2011 to 2024 were included and stratified by indication as elective, symptomatic, or ruptured. Results: among 90,370 EVARs performed across 400 centers, 76,350 were elective, 8,349 symptomatic intact, and 5,671 ruptured. Discussion: EVAR outcomes within the SVSVQI demonstrate persistently low in-hospital mortality and improving perioperative morbidity over time.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the July 2026 issue of Journal of Vascular Surgery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.